I hope I'm audible to every one of you. I would like to welcome
Yes,
everyone
you're
on the behalf
audible,
of
Uma.
Barak Associates. We are here to present a webinar on breast cancer awareness. As we all know, कि October का महीना breast cancer awareness का month है, and we have gathered here to know what breast cancer actually is and how we can prevent them. For that purpose, we have our honorable guest, Ma'am Hadia Khan, Ma'am Javeria Tariq, Ma'am Javeria Salman, and Ma'am Rida. And these guys are from WHO, World Health Organization, Department of Care. Hello, everyone. Assalamu alaikum, ma'am.
Walaikum assalam. How are you?
Walaikum assalam.
Walaikum assalam. Ma'am, आप सब कैसे हैं? खैर से? सब खैर है?
We're good. How are you?
Alhamdulillah.
I'm fine. So please kindly, can you guys please start with the presentation? It's over to you, Ma'am Javeria Tariq.
I'm gonna give it to our director of WHO, Rida Batul, for our introduction.
So, hello, assalamu alaikum everyone. My name's Rida Batul. I'm a fourth year medical student at Dow. As you all know, my team and I are here today to present breast cancer to you from CARE. Let me tell you a little bit about CARE. CARE is a student-led organization, and our main aim is to basically spread awareness on diseases such as breast cancer, online or in physical events. We also do a lot of volunteering and welfare work for our community. So today, as I said, our main purpose is to educate you about breast cancer, its prevalence, its sign and symptoms, its prevention, along with a Q&A session. So normally we have these events physically where we can talk to everyone because we want the session to be interactive for you guys to ask as many questions as you want. But since we're having an online session, I would still sort of want you guys to ask the same amount of questions to interact with us. We're open to any interactions. So without further ado, let's start.
Okay, so assalamu alaikum everyone. My name is Javeria Salman, and I'm the HOD of the WHO department at CARE, and I'm also a fourth year MBBS student at Dow Medical College. So starting off, I'm sure सबको ही पता होगा, सबने सुना होगा कि October is Breast Cancer Awareness Month. थोड़ा बहुत सबको ही पता होगा breast cancer के बारे में. A lot of people are doing awareness nowadays, which is really good. But let's start off with the introduction कि cancer होता क्या है. तो हमारी बॉडी में जो नॉर्मल सेल साइकिल होती है उसमें सेल्स दे ग्रो एंड देन दे गो थ्रू अ प्रोग्राम सेल डेथ. ये नॉर्मल है, ये अच्छी बात होती है. जो कैंसर सेल्स होते हैं उसमें एक प्रोग्राम सेल डेथ नहीं होती है. ये सेल्स दे ग्रो आउट ऑफ कंट्रोल, दे ग्रो एबनॉर्मली एंड दे ग्रो फास्टर देन द रेगुलर सेल्स ऑफ आवर बॉडी. तो इस डिजीज को हम कैंसर कहते हैं. और ये कैंसर किसी भी बॉडी के पार्ट में हो सकता है, किसी भी ऑर्गन में हो सकता है. टुडे वी आर गोइंग टू बी टॉकिंग अबाउट ब्रेस्ट कैंसर. तो जो भी ब्रेस्ट टिश्यू है up from the breast area up to your armpits इसको हम breast tissue consider करते हैं, और any abnormal growth is called breast cancer. So surprisingly, Pakistan has the highest incident rate of breast cancer in all of the Asian countries. 1 in every 9 women has a lifetime risk of being diagnosed with breast cancer, which is a very shocking statistic. और हम आगे जाके आपको बताएंगे कि why is this so prevalent in Pakistan. Obviously, for every disease, including cancer, early detection सबसे अच्छी चीज होती है. The earlier you detect any disease, any cancer, the earlier the stage 1, stage 2, the earlier it is, the better your treatment plan is, the better your results are, and the longer your survival is. And a lot of people ये समझते हैं कि breast cancer is a death sentence, और अगर आपको कैंसर डायग्नोज हो गया है तो बस आपकी जिंदगी खत्म हो गई है और उसका कोई क्योर नहीं है, कोई ट्रीटमेंट नहीं है. But this is not true. Actually, 90% of women जिनको breast cancer diagnosed भी होता है तो they survive 5 years after their diagnosis. और आप जैसे नीचे देख सकते हैं, हमने स्टेटिस्टिक डाला है जिसमें ये लिखा हुआ है कि in 2025, by 2025, 75% of women above the age of 55 will have a risk of getting breast cancer, which is a very shocking statistic. और ये बहुत concerning भी है. Before we move on to the next slide, I would like you guys to tell me in the chat कि आपको क्या लगता है कि दुनिया में सबसे कॉमन कैंसर कौन सा है, जो सबसे प्रिवेलेंट है पूरी दुनिया में, वर्ल्ड वाइड सबसे कॉमन कैंसर कौन सा है. It's okay. You guys can answer whatever you think is the correct answer. Okay, breast. Okay. Okay, so let's move on to the next slide. Breast cancer and lung cancer. Okay, good. Okay, someone raised their hand. Yes. You guys can ask your question in the chat. We're gonna. Okay, good. Lung cancer. अच्छा, वैसे तो lung cancer, breast cancer सबसे ज्यादा common है, लेकिन दुनिया में जो सबसे ज्यादा common है वो breast cancer ही है. Lung cancer is the second most common cancer, but breast cancer दुनिया में सबसे common है. और जैसे कि आप लेफ्ट हैंड साइड पे देख सकते हैं चार्ट में, breast cancer की deaths भी सबसे ज्यादा हैं दुनिया में out of all the cancers in the world. Moving on. अब हम बात करेंगे stigmas, the stigma in our society and the stigma overall about the breast self-examination. अब जो breast self-examination होती है, this is the easiest, the most simplest tool, the quickest tool, the cost-free and the most accessible tool you can use to check the overall health of your breast. And अब तो recommend किया जाता है कि all girls above the age of 20 should do a monthly breast examination. It takes hardly 5 minutes to perform this examination. And actually इतना beneficial इस वजह से है कि 64% of breast cancer cases have been diagnosed because these women performed a breast self-examination. But एक मसला इसमें ये है कि less than 14% of women actually perform a breast self-examination monthly. अब ये क्यों होता है, हम बात करते हैं इसके बारे में. So the number one reason is the lack of awareness, the ignorance about breast self-examination. कुछ लोगों को पता ही नहीं होता कि breast self-examination कोई चीज भी होती है, कुछ लोगों को पता ही नहीं होता कि उसके steps क्या होते हैं, कुछ लोगों को ये भी नहीं पता होता कि सही से कैसे breast self-examination कैसे करते हैं. I will tell you guys about a personal experience. Recently, I was talking to one of my relatives about a breast cancer case I saw at civil hospital. और through that conversation, मुझे ये पता चला कि she recently discovered a lump around her armpit area. But उसको ये नहीं पता था कि this lump is also, you know, it could be breast cancer. उसको ये लगता ही नहीं था कि armpit का जो area है वो breast tissue भी consider किया जाता है. And because I told her about this, that's when she realized the severity or the seriousness of this, you know, condition. I don't think she had breast cancer, but you know, it's very important to make people aware of this. Another thing is the fear. बहुत सारे लोगों को लगता है कि if you find out about something, that means you have to acknowledge कि वो चीज़ है actually. और obviously common बात है कि no one wants to have cancer. It's a very scary thing, but बेहतर है कि आप कुछ बात ये चीज़ जल्दी पता चल जाए, आप जल्दी से डायग्नोसिस करा लें, आप अपनी ट्रीटमेंट जल्दी से करा लें. अगर आप लेटर स्टेज पे इसको डिस्कवर करेंगे तो ऑब्वियसली और मुश्किल उसको ट्रीट करना हो जाएगा. Another thing is the embarrassment. हमारी सोसाइटी में and obviously also societies around the world, इसमें ये चीज़ है कि breasts are considered some kind of, you know, taboo thing to talk about. Even though breasts should be treated like a normal part of our body. इसमें जैसे आपके brain है, आपके lungs हैं, आपके हाथ पाँव हैं, सब कुछ है. Breast should be a normal, you know, conversation जब हम cancer के बारे में बात करते हैं. Another thing is carelessness. Some people just don't care. उनको लगता ही नहीं है कोई सीरियस बात है, उनको लगता ही नहीं है कि उनके साथ भी शायद ये हो सकता है, उनको सीरियसनेस पता ही नहीं है इस चीज़ की. एंड दिस इज़ व्हाई इट्स सो इम्पोर्टेंट कि हमारी जनरेशन हम एजुकेट करें लोगों को इन चीज़ों के बारे में, और हम ये इन स्टिग्मास के अगेंस्ट फाइट करें और हम अवेयरनेस फैलाएं. वी आर सो लकी कि हमारे पास, you know, information is at the tips of our fingers. So it's our job to fight against these stigmas and educate people about breast cancer. Moving on. Acha, so I want to ask you guys, can men get breast cancer? Okay, yes. Okay, good. Yes, men can get breast cancer. yes ratio is low. Less than 1% of men actually, less than 1% of breast cancer cases actually men में होते हैं, but ऐसा नहीं है कि men में हो ही नहीं सकता है. Okay, moving on. अब हम risk factors के बारे में बात करेंगे. So, what are some of the things that increase your risk of developing breast cancer? सबसे पहली चीज alcohol consumption है, which is obviously not common in our society, but worldwide देखा जाए, this is also up there with the list of things that increase your risk of developing breast cancer. Another important thing is family history. जिनकी अम्मा को, जिनकी बहनों को, जिनकी खालाओं को या जिनकी maternal grandmothers को breast cancer हुआ है, उनकी भी risk बढ़ जाती है of developing breast cancer. So a family history has a very strong correlation of the increased risk of breast cancer. Another thing is old age. This is not just applicable to breast cancer, this is applicable to all cancers. आपकी body जब age बढ़ जाती है, obviously आपके cells old हो जाते हैं, तो उसकी वजह से आपकी mutations होने के chances, आपके disease होने के chances बढ़ जाते हैं. Another thing is tobacco use. सबको पता होगा smoking is like poison for your body, तो ये body के हर organ system को affect करता है. Another thing is reproductive history. जिन औरतों के periods late आते हैं, जिनकी menopause late आते हैं, जो कभी pregnant नहीं होती हैं या फिर जो कभी breastfeeding नहीं कराती हैं अपने बच्चों को, उनकी increased risk है of developing breast cancer. अब obviously risk factors does not mean कि अगर आप में risk factors हैं तो आपको लाजमी breast cancer होगा, लेकिन ये बस आपके chances बढ़ा देंगे from the normal population of developing breast cancer. Acha, moving on, I would like to pass the mic to Javeria Tariq, who will be telling you guys more about breast cancer. Thank you.
Hi guys, my name is Javeria Tariq. I'm a third-year medical student at Dow, and I am a member of WHO. So now I'm gonna let you guys know the role of genes in breast cancer. So like Javeria before explained, cancer is basically when your cells divide continuously. So your cells, they're supposed to divide and they die. But in cancer, these cells don't die. And there are genes in your body that control this. So genes are basically, it's like, for example, like they are like instruction manuals for your cells on what to do. So we're going to talk about two different genes that can cause breast cancer. So first, we've got a proto-oncogenes. These genes, they basically tell the cells how to grow, how to divide, and how to live. In those proto-oncogenes, जब mutation होती है, so mutation is basically any change in the gene. कोई भी change अगर gene में आ जाए, उसको mutation बोलते हैं. तो अगर proto-oncogene में mutation हो जाए, so because a proto-oncogene like regulates all of this dividing and growing of the cell, जब वो mutate हो जाए और वो change हो जाए, so these cells they divide continuously and they don't die, which results in cancer. And another gene which can cause breast cancer is a tumor suppressor gene. So basically, the tumor suppressor gene, it regulates mitosis, repair of DNA mistakes, and cell apoptosis. So mitosis is division of cells, and cell apoptosis is dying of cells. So just like the proto-oncogenes, this also regulates the life cycle of the cell. So when these tumor suppressor genes, जब इसमें mutation होती है, so it stops, like the cell keeps on living. It does not die because it doesn't have instructions on when to die. So because the cell keeps on living, it keeps dividing again and again causes cancerous mass in your body. And this is not specific for breast cancer. This is not specific for breast cancer. It can happen in any cancer. So genes, like I said, were instruction manuals for your cells. Now there are, and जब उनमें mutation होती है, there's two types of mutations that can occur. There are acquired mutations and inherited mutations. The acquired mutations are something that you get from your environment, something that happens later on in your life. And examples of that can be like radiation, any chemicals that you're having, any chemicals that you've been exposed to, for example, lead, or any random event occurring inside your cell during your life. And these random events are mostly unknown, and we don't know much about them. But other causes, acquired causes, can be, like I explained, radiation and chemicals. Now, inherited gene mutations are something that is passed down from parent to child. So, for example, if your mom had breast cancer, or if your grandmother had breast cancer, you have a higher chance of getting breast cancer. You're at higher risk. And for example, the BRCA gene, if your parents, like if your mom or grandmother or any other like relative of yours had a mutation in this gene, it is possible for you to have that mutation as well. So this is inherited when it is passed down from parent to child. And 90% of breast cancer cases are caused by acquired gene mutations. So 90% of breast cancer happens because of things that happen later on in your life. And mostly this is random. And only 10% is inherited. So only around 10% of breast cancer cases are because of your relatives or anyone around you having breast cancer. So now we're going to go through symptoms of breast cancer. Now, this is very important because it can help you as a person detect breast cancer in yourself. So you guys have to pay attention to this. So some of the symptoms of breast cancer include, obviously, changes in the nipple or changes in the breast itself. So nipple changes can include pain, crusting, any sort of discharge coming out of the nipple, whether it, for example, bloody discharge. And in your breast itself, for example, if you have a lump in your breast or you change in color in your breast. And pitting of the breast is, if you guys have ever seen an orange, uski jo skin hoti hai, uspe chote chote dane hote hain. When that same texture comes on your breast, this is called pitting of the breast. Now, not all of these, if you have the symptom, it doesn't necessarily mean that you have breast cancer, but it is definitely like a symptom of it. So you should definitely get it checked out. And this is the reason why it's so important for us to examine our breasts every month. It's just 5 minutes. You can look through, inspect, and palpate. So you can like catch any of these symptoms, because the faster you catch these symptoms, the higher your survival rate, the easier it is to treat the cancer. So yeah. Now there are precautions that we can take to prevent breast cancer. Let's go through all of them. First would be maintaining a healthy weight. So obese women have a 12% higher chance of getting breast cancer. So it's very important to maintain a healthy weight. And exercising daily and eating healthy is also very important, because a healthy lifestyle prevents cancer from forming, because exercising daily and eating healthy can cause like certain hormones, and it can cause those hormones to get regulated, so it doesn't cause breast cancer. And like Juria before said, breastfeeding lowers your exposure to hormones that can cause breast cancer. And obviously, alcohol and smoking are two important things. These are both carcinogens, so both of these things can cause cancer. So if you avoid both of them, it is obviously it will prevent you from getting breast cancer. Oh. Okay, people who've raised their hands, have you guys got any questions?
Fiza Maiman wants to ask her then how it can cause breast cancer. She's talking about the tumor suppressor gene.
Okay, so basically we said that the tumor suppressor gene, usme mutation hoti hai. So that means the gene itself is changing. I'm not saying that the gene causes breast cancer. I'm saying the gene changes. So the job of the tumor suppressor is to suppress the tumor, to stop these cells from dividing uncontrollably. So jab usme change aata hai, wo sahi se kaam nahi karta. So it cannot stop these cells from dividing, and hence it causes cancer. I hope that clears your question. If you've got any more doubts, you can let me know.
Ma'am, Ayman Raza is asking, what is the age in which the cancer is the most founded in, the breast cancer?
Cancer mostly develops after the age of 40. It has a higher risk of being formed after the age of 40, but obviously it can happen in any kind of breast tissue from as soon as you hit puberty. So it's always important to check no matter what your age, but after the age of 40, it's even more important because the risk is much higher.
Okay. Ma'am, can you please kindly tell any misconceptions about the breast cancer that people think that it is a cancer or not.
Yeah, I'm going to move on to Hadia. She will take over the presentation. We will go over this as well.
Assalamu alaikum. Again, I'm Hadia. I'm a third year medical student at Dow. I want to ask you guys if you know, before I even show you this, do you guys know what the screening methods of breast cancer are? मतलब अगर आपको ये पकड़ना है to make sure that it doesn't progress, what are the screening methods that you know of? We've discussed a few already. Bukhari, we will answer your question by the end. We have something addressing this. Mammography, perfect. And what other thing that we just discussed recently? Abhi, I think Jabir had mentioned it. Okay, it's okay. I will explain it. So, mammograms are very important for anyone above the age of 40. तो अगर आपके घर में आपकी mother, आपकी फूफू, आपकी ताई, आपकी खाला जो भी है उनको ज़रूरी है कि साल में एक बार एक मैमोग्राम कराएं और मैमोग्राम सिर्फ और सिर्फ एक आपका चेस्ट का एक्सरे होता है. And it's a very simple procedure. Most hospitals have it. अभी जो है शौकत खानम में मेरे ख्याल में free checkups or free consultations चल रही हैं. Uske alawa, there's the second one that I was trying to talk to you about is self-examination, which is ke aap jaye mahine mein har baar after the age of 20. I'm sure most of us here are uni students, so hum sab above 20 hain. Once every month, stand in front of the mirror and examine your breast. We have a video coming up just to explain the proper way, but ये बहुत बहुत ज़रूरी है क्योंकि अगर आपको नहीं पता होगा कि आपकी breast में क्या changes आए हैं तो आप इस चीज़ को आप checkup नहीं करा सकते हैं. Because हाँ, it is more common after the age of 40, but it could happen at any age. हमने hospital में like cases as young as 14-year-olds, 20-year-olds, 30-year-olds देखे हैं. So it is very, very important to do a self-examination at every month. चाहे वो आप अपने like period के साथ time करें या आप एक date set कर लें. It takes 2 minutes. You go in front of the mirror for 5 minutes. You just check your breast ताकि you know any changes that are taking place. उसके अलावा there are things like breast MRI and 3D mammographies जो ज़्यादा detail में अगर आपको check करवाना है कुछ चीज़ अगर हाथ से निकल आए mammogram में तो then you can get this further examined. I'm going to go to the next slide. Why women above 40 should get screened. So we've been saying this again and again, women above 40 should get screened. Because above 40, there is a higher risk. And a higher risk means कि अगर आपने साल में एक बार नहीं check करा है, so there's a chance कि वो cancer एक साल में stage 1 से stage 3 तक बढ़ जाए. और फिर जो है वो उसको manage करना बहुत मुश्किल हो जाता है. क्योंकि stage 1 में you can do chemotherapy, you can do radiation, you can do surgery, and inshallah you will be fine if खुदा ना खास्ता आपको हो. But once it progresses from stage 1, 2, 3, 4, when it comes to stage 3 or 4, management is very difficult. आपकी like जिंदगी में मुश्किलात बहुत होते हैं. So for those reasons, it reduces the mortality rate, which is the death rate. It makes sure your आगे वाली जिंदगी is way easier because जितना वो progress होगा उतना आपकी body में damage होगा जब आप treatment के लिए जाएंगे. And then again, most life stage. Like we said in the first slide, 90% of people diagnosed early can get a clear treatment by the end of 5 years. In this next slide,
breast cancer is the most common.
Sorry, 1 second. We have a video to explain how to do self-examination, which again is very important. So please watch this.
Cancer affecting women in Singapore. Breast
It is
cancer
estimated
is the most
that
common
one in
cancer
14
affecting women
before the
in
age of
Singapore.
75
will
is
develop
estimated
breast
that
cancer
1 in
in her
14
lifetime.
women before the age of
You can keep
75
a lookout
will
for
develop
breast
abnormalities
cancer
in her
starting
lifetime.
with a visual examination
You can
of
keep
the
a
breast
lookout for
with your
breast
arms by your
abnormalities
side in a neutral
starting with
position
a visual
in front of
examination.
Is the audio okay for you guys? Because it's not working for me.
Ma'am, आवाज आ रही है. Can continue.
The video, like video की audio
To
सही है?
mirror breast with your
Where is saying the audio is messed up? Okay, I'm just
Audio ना
give me 1
आपकी
second.
mic से वापस आ रही है.
Oh, okay, right.
Arms by your
any of
side
the
in a
following.
neutral position. In
Changes
front.
So sorry, give me 1 second. Where is it?
Okay, till we start with the video again, can we answer the questions in the chat box? Like Ma'am Bukhari is asking, can you clear the myth that breast cancer spreads from person to person by touching or staying together? Ma'am Javeria Salman, can you please answer?
अच्छा, तो ब्रेस्ट कैंसर एक कंटेजियस डिजीज नहीं है. इट्स नॉट लाइक एन इन्फेक्शन. आप टच करके दूसरे को स्प्रेड नहीं कर सकते, कैंसर स्प्रेड नहीं कर सकते. और दिस इज फॉर ऑल कैंसर्स. कैंसर आपकी बॉडी के अंदर से शुरू होता है, आप किसी और बंदे को नहीं दे सकते. इट्स नॉट लाइक एन इन्फेक्शन. ये आपकी बॉडी के सेल्स का खुद का डिफेक्ट होता है. आई होप दैट क्लियर्स अप योर डाउट.
So sorry for the whole thing, guys. I'm just going to play the video, and most of these questions we'll answer at the end.
Okay, sure, ma'am.
Cancer affecting women in Singapore. It is estimated that 1 in 14 women before the age of 75 will develop breast cancer in her lifetime. You can keep a lookout for breast abnormalities, starting with a visual examination of your breast with your arms by your side in a neutral position in front of a mirror. Look for any of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple, persistent rash or change in the skin around the nipple, nipple inversion, retraction, bleeding or unusual discharge, skin redness or soreness of the breast, accentuated veins of the surface of the breast, unusual swelling of one upper arm. Adopt the following 2 positions. Raise your arms above or behind your head. Press your hands on your hips and tense your chest muscles. These 2 positions allow for a closer inspection of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple. To feel for changes in your breasts, underarm, and collarbone areas more accurately, do so by lying down because the breast tissue spreads out evenly across your body. This makes it easier to feel for lumps. What you should look out for: a lump, swelling, or thickening in the breast or underarm area, any enlarged lymph nodes at the underarm and above the collarbones. Lying down. How to examine your breasts when lying down. Elevate your right shoulder by placing a folded towel or pillow underneath. Extend your right elbow outwards and place your right hand under your head. Use the pads of your 3 middle fingers and apply pressure to feel your breast tissue in a circular motion. Use 3 varying pressure levels: light, medium, and firm, to feel for all the breast tissue from the skin level to tissues closest to the muscles and ribs before moving on to the next area. Examine the whole breast systematically in a clockwise or anti-clockwise direction. Press down over your nipple with 3 varying pressure levels in a circular motion. To check for lumps at your underarm area, put your arms by your side. Start in the hollow of your underarm and move towards your breast, making overlapping small circular motion. To check above the collarbone, Use light pressure and move in a circular motion. Repeat the same steps on your left side. How often should you perform breast self-examination? The best time to perform a self-examination is about a week after the start of your menstruation. It is more effective to perform on the same day of each month if you are no longer menstruating, pregnant, breastfeeding, or have breast implants. It is important to understand that breast self-examination can complement breast cancer screening, but it is not a substitute for it. Most lumps or changes in the breast are not cancerous, but as a precaution, it is advisable to consult a doctor as soon as possible.
Okay, so that was the video on how to do breast cancer self-examination. Yeah, so again, I'm going to emphasize this, that we do need to do this like every single month, because literally yesterday I was talking to one of my friends and she was telling me that she knew someone, her aunt, who had been doing these self examinations, क्योंकि हम ये चीजें हम सुनते बहुत हैं मगर हम तब भी करते नहीं है, but she was like, alhamdulillah, she was doing it and she caught it, and it was stage 1 breast cancer, and in a year उनको treatment के साथ alhamdulillah she is perfectly fine now. But like I want to emphasize this क्योंकि again we hear these things, हम हर चीज के बारे में advice सुनते हैं, बहुत ये अक्टूबर में चलता है, but we never actually pay attention to it. So self-examination is very important. It's free of cost. It's very छोटी सी 5 मिनट की चीज होती है, but it could save you बहुत trouble in the future. Now I'm going to come to the myths that everyone keeps asking about. So the first one, talking about cancer causes cancer. ये वैसे पढ़ने में तो बहुत like ridiculous लगता है, मगर हमने देखा होगा, हमने सुना होगा, especially like पाकिस्तान में अपने घरों में कि ऐसी चीजें जब हम डिस्कस करते हैं तो सब चुप कर जाते हैं कि अल्लाह ना करे, ऐसी बातें ना करो, कि बात करने से ही जो आपको जो है ऐसी चीजें हो सकती हैं. This is not true. This is a myth. ये वहम है, और this is actually very harmful, क्योंकि अगर हम ये चीजें डिस्कस नहीं करेंगे तो हमें इन चीजों की नॉलेज नहीं होगी, और अगर नॉलेज नहीं होगी तो अगेन हम इस चीज को पकड़ नहीं पाएंगे. Another thing I've heard is a bruise on the breast will lead to breast cancer. कि हमें अगर कहीं चोट लगेगी या कुछ जख्म होगा तो उससे आपको breast cancer हो सकता है. Like the way Javeri explained, breast cancer is not something that happens किसी चोट से. It happens because your genes have a mutation और आपके cells जो है multiply करने लगते हैं और एक tumor बन जाता है. So this is again a big myth that should not be believed in. If an incision is made during breast cancer surgery, the cancer will spread. People think कि अगर आपकी कोई mastectomy होती है, which is जब आपका breast remove होता है because of a breast cancer tumor, तो उससे भी आपका cancer मतलब और फैल सकता है. That's not true, because again किसी चोट से, किसी चीज से आपको कैंसर नहीं हो सकता है. हाँ, जिनको ब्रेस्ट कैंसर हुआ है उनको रिस्क ज्यादा है फिर से ब्रेस्ट कैंसर होने का, मगर इसका मतलब ये नहीं है कि उनकी सर्जरी की वजह से, उनकी रेडिएशन की वजह से, उनकी कीमोथेरेपी की वजह से उनको फिर से कैंसर हो रहा है. That is false. Another thing, getting too many mammograms lead to breast cancer. People know कि X-ray से रेडिएशन होती है और रेडिएशन से कैंसर होता है. That is 100% true. मगर एक साल में एक मैमोग्राम कराने से आपको कुछ नहीं होने वाला, आपको उसकी वजह से जीन म्यूटेशन नहीं होगी और आपको उसकी वजह से कैंसर नहीं होगा. It's not true. Breast cancer only affects older women. Yes, it affects people above 40 more. उनको रिस्क ज्यादा होती है, but it does not mean कि सिर्फ 40 के बाद ही आपको breast cancer हो सकता है. खुदा खासा at the age of 20, at the age of 30, we've seen cases that have breast cancer. If you have high risk factor for breast cancer, you are definitely going to get it. Not 100%. हाँ, अगर आपकी फैमिली में हो आपको रिस्क होगी, but ये जरूरी नहीं है कि आपको कैंसर होगा. Using antiperspirants cause breast cancer. Antiperspirants मतलब deodorants वगैरह. लोग समझते हैं कि अगर आप अपने armpits पे deodorants लगाएंगे तो उससे आपकी मतलब ducts lymph nodes जो है वो ब्लॉक हो जाते हैं और उसकी वजह से आपको कैंसर हो सकता है. Again, that is not true. That is not possible. Breast cancer is mutation की वजह से, उस genes की वजह से. It does not have to do with कोई चीज जो आप apply कर रहे हैं. A breast cancer diagnosis is an automatic death sentence. Nahi, breast cancer can be treated. There's chemotherapy, there's radiation, there's surgery. People come out of it. In 2 or 3 or 4 years, inshallah, they will be completely fine, depending on the stage it is. Now I'm going to address a few of the questions that were about myths. Yes, Mr. I think Buhari asked, can you clear the myth that the breast cancer spreads person to person? I think Jabari already answered that. Ariba Mumtaz, you raised your hand. अगर आपको question पूछना है या तो आप chat box में कर दें या आप unmute कर दें.
Asma Latif is asking, ma'am, can mammography explain करते हैं?
Okay, mammography, great question. Mammography is, like I said, it's an X-ray of the breast. उसमें आप जाते हैं, they put your breast between a machine and basically एक X-ray, अगर आपने कभी X-ray लिया होगा तो it's just like that कि बस एक मशीन होती है, वो उसको स्कैन करती है और उसमें अगर कोई लंप वगैरह होता है तो वो चीज़ सामने आ जाती है. और अगर कुछ क्लियर नहीं होता तो फिर आपको आगे जाकर CT MRI करवाते हैं. Does that clear your question?
Okay.
Yes, ma'am. And ma'am, Farwa Rai is asking, what is the most curable breast cancer?
What is the most favorable?
Curable.
Curable breast cancer.
What is the most curable breast cancer?
Basically,
There is not exact. Yeah,
हाँ.
brother, please go answer the question.
So basically, breast cancer की कोई exact types नहीं होती, लेकिन it can be stages. तो breast cancer की stages होती हैं, like all other cancers. तो जो भी stage 1 होगा और 2 होगा, they're easily treatable. Stage 3 and 4 में there's other symptoms too, which makes it harder for the breast cancer to be treated. Obviously, फिर chemotherapy, radiation की तरफ जाएगा और survival के chances कम हो जाते हैं. इसलिए Hadia and Javeria and all of my team members are saying कि catching it early is important क्योंकि फिर treat करना is easier. So I hope that clears your question. Okay, Javeria and Hadia and everyone, there's a lot of questions.
Can breast cancer cause death?
Can breast cancer cause death? Breast cancer can cause death. It means fatality compared to other cancers नहीं है. जैसे अगर आपके brain में cancer होगा, तो obviously that you can just tell कि उसकी mortality और morbidity rate ज़्यादा होगा compared to breast cancer. It can, अगर आपके पास prevention techniques नहीं है कोई, अगर आप treatment सही से नहीं करवा रहे, it can obviously lead to death.
Okay.
अच्छा, I would like to add to this कि जो breast cancer की stages होती है ना, stage 1, 2, 3, 4, वो हम determine करते हैं by the size of cancer tissue कितना है और उसका spread कितना है. आप लोगों ने सुना होगा कि उसका cancer lungs तक spread हो गया है या liver तक चला गया है, brain तक चला गया है. तो जब cancer different organs में जाके spread हो जाता है और वो वहाँ पर मसले करना शुरू कर देता है, तो तब जाके आपका death के chances बढ़ जाते हैं. तो इसी वजह से stage 1 वो limited रहता है breast tissue में, उसको आप हटा सकते हैं. लेकिन जो कैंसर स्प्रेड हो जाता है तो आपके फिर बॉडी के कितने पार्ट से आप हटाएंगे, तो उसका कोई ट्रीटमेंट नहीं होती, इसकी कोई क्योर ही नहीं होता है फिर. आई होप दैट आंसर्स योर क्वेश्चन.
I see a question by Asma. Breast cancer drugs use करने से होता है क्या? Drugs मतलब if you're talking about any type of drugs, yeah, if you're talking about pharmaceutical drugs, there aren't really any proven drugs जिससे cancer हो सकता है. या अगर ये चीज है तो it's not like scientifically अभी तक कोई ऐसी चीज प्रूव हुई भी नहीं है. अगर आप कहेंगे drugs like recreational drugs, उससे कैंसर का ताल्लुक नहीं है, बट हाँ जैसे अगर उसमें टोबैको है तो उस चीज से it is a carcinogen, so it can cause cancer. Would anyone like to add on to that?
No, I think you covered it pretty much. There's another question. Do fibroadenomas have the potential to develop into breast cancer after the lump has been surgically removed? So fibroadenoma, the word adenoma basically tells you कि ये benign है. It is not cancer causing. So अगर आप एक adenoma को हटा रहे हैं, आप basically एक benign growth हटा रहे हैं. तो it's not breast cancer. वो वाली चीज अलग है. So it can cause breast cancer until and unless आपके पास पहले से एक genetic component है to cause breast cancer. Okay.
अच्छा, to add to this, ज्यादातर आपने जैसे वीडियो में ही देखा होगा सबने के most lumps in the breast are not cancer. Most lumps in the breast वो benign होते हैं, जैसे fibroadenomas हो जाता है, fibrous changes हो जाती हैं, या फिर कभी कभी lipomas भी हो जाते हैं लोगों को. तो ये सब नॉन कैंसरस हैं. ये बस थोड़ा सा एक जो आपके नॉर्मल टिश्यू होता है वो थोड़ा सा ग्रो हो जाता है. ये कैंसर की वजह से नहीं होता है, लेकिन ये बस एक थोड़ी सी ग्रोथ होती है जो मतलब हार्मफुल नहीं है. तो ज्यादातर लम्स आपके ब्रेस्ट में हार्मफुल नहीं होते हैं, लेकिन आप ऑब्वियसली हमें क्या पता कि वो कैंसरस है या नॉन कैंसरस है. सो इट्स ऑलवेज बेस्ट टू गेट इट चेक्ड आउट ताकि आपको तसल्ली हो जाए.
Okay, someone just asked whether breast cancer can affect the heart. So like Julia explained before, breast cancer starts off in your breast, but if you let it progress till the later stages, there are stages 3 and 4, usme, if it's like the cancer slowly starts spreading throughout the body. So it can eventually lead to your heart, but if that is in very, very later stages. Shuru wali stages mein, it does not affect the heart.
Okay. So there's this question ke Abir, was someone saying something?
No, go ahead.
Okay. So someone Abir asked, okay, my question is that breast cancer can happen with any kind of external physical damage to the breast. Kicking her legs, mother's breast, probably a clot formed or something, but she got breast cancer. अच्छा, तो in this case, ऐसे cases बहुत आते हैं हमारे clinic में. तो one of the myths that Hadia discussed was that कि अगर आपको चोट लगती है आपके breast में, वो उससे breast cancer form नहीं होता. लेकिन just like any other trauma or any other जो आपको चोट लगती है, अगर आपको हाथ पे भी चोट लगेगी, एक clot form हो जाएगा. A blood clot would form, आपको bruise होगा. Similar अगर आपको ब्रेस्ट पे कोई चोट लगाएगा, आपको एक क्लॉट फॉर्म होगा, हीमेटोमा फॉर्म होगा और ब्लड वेसल्स वहाँ पे आ जाएंगे इंगॉर्ज होके. लेकिन क्लॉट रिलीव करने के लिए भी अलग फैक्टर्स होते हैं. नॉर्मली ब्रेस्ट फीडिंग के दौरान हो जाता है, मिल्क क्लॉट्स फॉर्म हो जाते हैं. इन दिस केस आपने जो बोला है, द मदर गॉट ब्रेस्ट कैंसर व्हिच मोस्ट डेफिनेटली हैपेंड क्योंकि उनके पास एक जेनेटिक कॉज था, नॉट बिकॉज द बेबी किक्ड हर. So, okay.
Ma'am, somebody is also asking how many stages are there in the breast cancer actually?
हम ना
So,
अच्छा, so there's 4 stages in
नहीं, you can, yeah.
answer?
You can answer.
अच्छा, सही है. So there's total 4 stages in all cancers. कुछ stages में 5, कुछ cancers में 5 stages भी होती हैं, लेकिन generally हम 4 stages तक ही बात करते हैं. उसमें भी 1, 3A, 3B, 3C इस तरह की उसमें सब stages भी होती हैं, but generally 4 stages. अच्छा, हमना asked a question कि some people say that wearing black colored undergarments can lead to breast cancer. नहीं, इससे कोई ताल्लुक नहीं है. The color of your clothes or the color of your undergarments have nothing to do with any kind of cancer or any kind of disease in general.
There was another question like that about wearing tight clothes or tight undergarments that can cause breast cancer. There is no correlation as of now for anything like that. There is another question here. Not giving milk to their babies leads to breast cancer. Yes, mothers who do not breastfeed, they are at a higher risk for breast cancer. Just say if you get pregnant after the age of 30, you are also at a higher risk for breast cancer. So Ozair Khan, I hope that answers your question. There's a lot of questions about adenoma. I typed an answer in the chat box, so I hope that's clear.
Adenoma basically means, इसमें फिजा ने लिखा है, adenoma means the cancer will not spread. So there's a difference. जब ट्यूमर आपको मिलता है तो ट्यूमर डिवाइडेड होता है दो में, या तो बेनाइन होगा या मेलिग्नेंट होगा। बेनाइन इज समथिंग दैट डजंट स्प्रेड, वो मेटास्टाइज नहीं होता क्योंकि उसमें इतनी टेंडेंसी नहीं होती आपको बीमार करने की। मेलिग्नेंट ट्यूमर्स अगर आप ट्रीट नहीं करते, जैसे ब्रेस्ट ट्यूमर है या ब्रेन ट्यूमर, कोई ऐसा ट्यूमर हो, वो मेटास्टाइज होता है, वो अलग जगह पे जाके वो स्प्रेड करता है क्योंकि उसके पास इतनी टेंडेंसी, इतनी ताकत होती है वो करने की। एंड एडेनोमा डजंट हैव दैट कैपेबिलिटी, तो वो नहीं करता ऐसा। Okay.
The next question we have, Iman Shahid is asking, ma'am, what is the best cure for this disease?
Okay. तो like any other disease, हर स्टेज को ट्रीट करने के लिए अलग अलग चीजें होती हैं, सही है। पहली चीज तो आप प्रिवेंशन टेक्निक्स की तरफ जाएंगे। उसके बाद अगर प्रिवेंशन टेक्निक्स काम नहीं करती, कुछ मेडिकेशंस ऐसी होती हैं जो कैंसर सेल्स को मार देती हैं। So there are medications that are available. Hormonal therapies भी होती हैं जो मदद करती हैं to treat breast cancer. उसके बाद कीमोथेरेपी होती है या फिर targeted therapies होती हैं, सर्जरी होती है and made to remove the breast tumor, और radiation therapy भी होती है। अब जैसे if the tumor, the breast cancer has metastasized, मतलब वो spread हो गया है दूसरे organs के पास, तो अगर आपके पास वो जगह ही नहीं है जहाँ से लाइक ट्यूमर स्प्रेड हो रहा है, आप उस जगह को हटा दें तो कैंसर नहीं बचेगा। तो एक बहुत स्टिग्मा सराउंडेड ट्रीटमेंट प्लान होता है मेस्टेक्टमी, जिसमें आप ब्रेस्ट ही रिमूव कर देते हैं। सो दैट डजंट कॉज कैंसर, क्योंकि जब आपके पास ब्रेस्ट नहीं है तो वहाँ पे ट्यूमर फॉर्म नहीं होगा। तो ये मतलब एंड स्टेज ट्रीटमेंट होती है बिल्कुल। लेकिन लाइक एवरी अदर डिजीज, वी स्टार्ट ऑफ इजी और फिर हम बढ़ाते जाते हैं अपनी लेवल ऑफ ट्रीटमेंट अगर हमारे पास कोई रिस्पॉन्स नहीं आता।
Okay, someone has asked why breast cancer is more common than other cancers. So there are like a bunch of reasons for that. And one of that is because the breast tissue itself has a lot of cells in it, and these cells constantly divide and grow. So like I said, if cells are constantly dividing and growing, because there's a high number of cells, there's a higher chance for mutations, which can cause breast cancer. And then second thing is hormones. So breast can be affected by hormones like estrogen, for example, and these hormones can make the breast grow in size, change, for example, in pregnancy or during periods and stuff, and that can contribute to mutations, and that's why breast cancer is more common than cancers in other parts of your body.
Okay.
Barira asked if pus-filled boils जो हो जाते हैं breast पे, क्या वो भी cancer related हो सकते हैं? Any changes on your breast, and अगर आपको discharge हो रहा है कोई like especially nipples, अगर आपको pus निकल रहा है, something is coming out जो आपको normally नहीं होता है, तो you should definitely get it checked out, and a doctor can give you like a definitive answer कि if this is cancer related or it's not cancer related. So Barira, I hope this answers your question.
Okay, so Bukhari wrote, his grandmother has breast cancer. She firmly believes it will spread to other family members if we sit with her or touch her. She has now confined herself to a separate room. I would like you to please explain this to her in Urdu so she can understand and believe that it's just a myth. So, for Bukhari's grandmother, मैं उनको ये बताना चाहूँगी कि ये बहुत बड़ा मिथ है। हमारे सोसाइटी में आधे से ज़्यादा बीमारियां लोगों को लगता है कि ऐसे फैलती हैं, हम दूसरों के साथ बैठे हैं तो फैल जाएगी। ऑब्वियसली ज़्यादातर बीमारियों में ऐसा होता है, जैसे कोई वायरल हो या कोई ऐसी बीमारी हो, लेकिन ब्रेस्ट कैंसर जेनेटिकली होता है। हम जब पैदा होते हैं तो हमारे अंदर पहले से ही जीन जो कैरी करती है वो म्यूटेट होती है। अब बिकॉज ऑफ, तो बुखारी की ग्रैंडमदर इफ ही सिट्स अपने फैमिली मेंबर के साथ बैठने से उनको ब्रेस्ट कैंसर नहीं होगा। उनके फैमिली मेंबर्स को, उनके फैमिली मेंबर्स हाई रिस्क पे होंगे ब्रेस्ट कैंसर के, लेकिन और वो प्रिवेंशन टेक्निक्स की तरफ जा सकते हैं चेक करवाने के लिए कि वो बिल्कुल ठीक है, लेकिन नहीं, अपने फैमिली मेंबर्स के साथ टाइम स्पेंड करने से, उनके साथ बैठने से उनको ब्रेस्ट कैंसर नहीं होगा। और फिर बुखारी, आई वुड ऑल्सो लाइक यू टू सजेस्ट कि आप हॉस्पिटल सेटिंग में एक प्रोफेशनल ओपिनियन भी दिलवा सकते हैं अपनी ग्रैंडमदर को जीरियाट्रिक वाले या फैमिली मेडिसिन या साइकोलॉजिस्ट के पास जो मदद कर सकते हैं उनकी टू हेल्प फॉरगेट द स्टिग्मा, क्योंकि ये ईयर्स ऑफ बिल्डअप के साथ आता है ये वाला थॉट प्रोसेस, and this will take time. She will need some sort of therapy to help her overcome this issue. Okay.
Asma Latif asked if ये genetically transfer होता है. जी, if अगर आपकी फैमिली में है किसी को या कभी हुआ है, your mother, your खाला, your grandmother, there is a possibility कि आपको हो, and there's a specific gene called BRCA1 and BRCA2 जिसके लिए आप टेस्ट भी करा सकते हैं अगर आपको इस चीज़ का खौफ है. तो yes, अगर if it's in your bloodline तो हो सकता है कि आपको भी हो, which is why you should be more vigilant about your health.
And Nabila, was someone saying something?
Yes.
Sorry to cut you. Yes.
Why lactating mother has low risk for cancer, breast cancer?
I'm sorry, can you repeat?
I think someone asked कि lactating causes breast cancer. I mean, lactating की वजह से आपको risk क्यों कम होती है?
Lactating mothers में क्यों होती है कम ये cancer, breast cancer?
अगर आप
कि ब्रेस्ट फीडिंग की वजह से कैंसर के चांसेस कम होते हैं.
जी.
Jaber, do you want to answer or should I go ahead?
I can answer this question.
Sure, you can answer, no problem.
Okay. So
Okay.
basically जब mother breastfeed करती है, she is lactating, उनमें hormonal changes होती हैं. Estrogen एक hormone है जिससे आपका breast size increase होता है. और like I said, जैसे मैंने पहले बोला था, जब आपका breast size increase होगा, आपके cells divide होंगे, वो grow होंगे और उसमें आपका risk ज़्यादा हो सकता है cancer के लिए. जब आप breastfeed करते हैं, ये जो estrogen वाला hormone है, ये कम हो जाता है. तो आपके सेल्स कम डिवाइड करते हैं, तो इसकी वजह से रिस्क भी कम हो जाता है. और दूसरी बात ये है कि आपके सेल्स मैच्योर हो जाते हैं, तो जब सेल्स मैच्योर होते हैं उनका there is a less likely chance of them turning into cancerous cells. And another cause is there's obviously जब आप breastfeed करते हैं आपके पास you don't undergo menstrual cycle, so again you're exposed to lesser hormones. So this causes a lesser chance of breast cancer. I hope that explains.
Okay, thank you.
Ma'am, Nabira Andreep का एक question है कि is there any physical pain or immortal physical sensation when the cancer develops? Like how can we get to know कि cancer is developing inside our body?
I'll take that question. See, cancers usually are what people would call like a silent killer. Like you won't find out until वो आखिरी वाले stages में हो, फिर हो सकता है कि आपको pain feel हो. तो like it's not a symptom, but अगर आपको pain feel हो रहा हो तो please ही आप check कराएं, ज़रूरी. And there's another question by Tayyaba.
और मैम लाइफस्टाइल किस तरह से चेंज किया जा सकता है?
Yeah, I was just going to answer that. Javeri, I think, answered that during the presentation, but मैं फिर से बता देती हूँ कि yes, having a good diet, intake, exercise can reduce breast cancer के risk because obesity में breast cancer का risk 12% ज़्यादा है. तो अगर आप अपनी health का ख्याल रखें तो there is a lesser chance of you developing breast cancer. And stress reduction से ये कि आपके अगर hormonal balance रहें तो फिर again आपको chance कम है breast cancer का. I hope that's clear.
Acha, so I want to address something that Muqaddas said. He said breast cancer does have types. Yes, breast cancer has types. उसकी अलग types होती हैं कि जिस part आपका breast का affect होता है तो उसकी अलग types होती हैं. Lobular हो सकता है, आपके glandular हो सकता है, आपके areola को affect कर सकता है, आपके nipple को affect कर सकता है, आपके lymph nodes में भी जा सकता है. जो ब्रेस्ट कैंसर से फ्लूइड ड्रेन करती हैं उस चीज़ को हम लिम्फ नोड्स कहते हैं। तो और उसकी डिफरेंट सेल टाइप्स भी हो सकती हैं, जैसे हमने फिब्रोएडेनोमा के बारे में बात की, और फिर उसमें मेलिग्नेंट चेंजेस भी आ जाती है, मतलब जिसको हम कैंसर कहते हैं। तो यस, उसकी टाइप्स होती हैं, कुछ नॉन कैंसरस होती हैं जैसे फिब्रोएडेनोमा की बात की, और कुछ कैंसरस होती हैं जिसमें मेलिग्नेंसी आ जाती है, मतलब वो कैंसर सेल्स कहलाए जाते हैं। तो आई होप दैट क्लियर्स अप द डाउट्स। एंड यस, इट डिपेंड्स ऑन हार्मोन्स, जैसे जवेरिया ने बात की, एस्ट्रोजन इज अ हार्मोन जो ब्रेस्ट कैंसर की डेवलपमेंट में एक रोल प्ले करता है, और अक्सर ब्रेस्ट कैंसर की ट्रीटमेंट में हम एस्ट्रोजन ब्लॉकर्स दे रहे होते हैं औरतों को, ताकि उनकी जो ब्रेस्ट कैंसर टिश्यू की ग्रोथ है वो कम हो जाए। आई होप दैट क्लियर्स अप द डाउट।
Okay, I'm going to address Maria's question. So she's asking what tests can we get done, because she said that recently people in her family have passed away due to the cancer. So basically, अगर आपकी family में पहले से है तो आप genes test करवा सकते हैं, और 2 genes होते हैं BRCA1 और 2, उसका आप test करवा सकते हैं। और second, आप preventative measures ले सकते हैं, तो आप एहतियात कर सकते हैं। You can keep doing your breast examinations. You can, self-examine yourself, check for lumps, or undergo mammograms every year. So you should keep an eye out for any symptoms at all, so you can get it checked as soon as they show up to reduce the risk of the cancer developing further.
Aliza asked if a person could get cancer after getting hair removal laser treatment, या LASIK से अगर आपको कैंसर हो सकता है। As far as I know and as far as the studies go, नहीं, laser की radiation से आपको कैंसर नहीं हो सकता है. It's not something that's been proven. But obviously अगर आप ये चीज़ें करा रहे हैं तो एक डॉक्टर से आप कंसल्ट करें और वो आपको सही इंफॉर्मेशन बता सकते हैं।
अच्छा, टू एड्रेस द लेजिक थिंग, आई नो कि बहुत सारे लोग हमारी सोसाइटी में कहते हैं कि लेजर मत करवाओ, इससे कैंसर हो जाएगा, बट अब हम इतने एडवांस्ड हो गए हैं स्पेशली डर्मेटोलॉजिकल ट्रीटमेंट्स में, कि अब इसकी इतनी कोई हाई रिस्क नहीं है। मतलब इसकी कोई मेडिकल अभी तक कोई कोरिलेशन नहीं आई है, कोई साइंटिफिक प्रूफ नहीं है इसका कि लेजर कॉजेस कैंसर। आई नो कि ये मिथ है अभी तक, बट ऑब्वियसली आप अपनी डॉक्टर से एडवाइस लें ऐसे करने से पहले, एंड वट एवर डॉक्टर रिकमेंड्स उनको ऑब्वियसली सबसे ज्यादा पता होगा, तो यू कैन ट्रस्ट देयर एडवाइस। अच्छा, एक और क्वेश्चन मैंने देखा था ऊपर के, इज देयर एनी प्लेस दैट आई बिलीव समवन आस्क्ड कि कोई ऐसी जगह है जो फ्री चेकअप्स ऑफर करती है विद हाइजीन। वैसे एट द टाइम आई डोंट बिलीव कराची में ऐसी कोई जगह है जो फ्री मैमोग्राम्स ऑफर करती हैं वुमेन को। ऑब्वियसली एक एक्सरे है, ये एक yes, let me finish and then you can ask your question. जो फ्री ऑफर करती हैं आई डोंट थिंक सो, लेकिन अगर आप साल में एक दफा मैमोग्राम करा रहे हैं तो आई डोंट थिंक इट्स डिफिकल्ट और वेरी कॉस्टली फॉर यू। ज्यादा से ज्यादा 3-4 हज़ार का होगा, विच आई एम श्योर इज एक साल में कराना, विच इज इट्स बेटर टू डू इट देन टू नॉट डू इट। यस, जिसको क्वेश्चन पूछना था आप पूछ सकती हैं।
Ariba also has her hand up. Do you want to ask something, Ariba? Okay.
If there's any questions that we missed in the chat box, can you guys please repeat it again? Because mashallah, you guys are very curious to what सारे questions आए। वरना I
अभी
think we
recently
should
question
start
आया
on the
था
main.
कि if taking good diets can decrease the breast cancer symptoms.
Good diet?
Taking good diet can decrease breast cancer symptoms. Is it right or wrong?
Symptoms, अच्छा, like every other disease, आपको अपनी lifestyle changes बहुत important है breast cancer में. You need to eat healthy to be a healthy person. अब आपको breast cancer हो गया है, उसके बाद भी आपको जिंदगी में बहुत सारी चीजें हटानी पड़ेंगी. जैसे अगर आप स्मोकिंग की तरफ जाते हैं या कोई अनहेल्दी बाहर की चीज़ें खाते हैं, ऑब्वियसली वो प्रिवेंट करना एंड स्वैपिंग देम आउट फॉर हेल्दियर फूड इज बेटर. तो इट कैन हेल्प प्रिवेंट any sort of disease actually, not just breast cancer. तो या लाइफस्टाइल चेंजेस बहुत ज़रूरी होते हैं ब्रेस्ट कैंसर में, हर बीमारी में.
Someone asked what are the lumps that are associated with, most common lumps that are associated with breast cancer. It's very important to know that any sort of lump that you find in your breast could be an indication of breast cancer. So it's important to get all of them checked out. There can be hard lumps, there can be soft lumps, there can be lumps that are fixed in one place, there can be lumps that are moving around. It's important to get all of them checked because there can be a possibility either way.
Slides that we share with you all, don't worry about that. And secondly, thank you so much, Ma'am Javeria, Ma'am Hadia, Ma'am Javeria Salman, and Ma'am Rida for very informative session because ये topic ऐसा है कि इसको सबने taboo बना दिया and nobody talks about it frequently. And there are very myths and associated with this topic, like Bukhari asked, my grandmother has breast cancer and she is not allowed to sit with the family and all. But it is very important to know that it doesn't spread ऐसे ही. It is in genes and we can prevent it from a better diet and fruits and everything. So thank you so much everyone for making this webinar wonderful experience for every one of us actually. And can we kindly go to the end of the session? Is there anything you want to say, ma'am?
So thank you so much for having us here today. We were looking forward to meeting you guys actually में मिलकर, but this session has been amazing. We had lots of questions and I hope we've somehow helped all of the people that were sitting here, all of the boys, all of the girls. Thank you so much for having us. We're honored.
Thank you so much everyone. You were a great audience and I hope सबको at least एक चीज आप लोगों ने सीखी होगी आज and I hope आप दूसरों तक ये information spread करेंगे ताकि it can help anyone one day. आपको नहीं पता आप किसकी help कर दें एक दिन. तो alhamdulillah, thank you so much. Take care and thank you for being such a great audience.